Hi, I'm Brian Finestein, CEO of St. Clare's Health. Welcome to Let's Talk Health. I'm here with Dr. Barry Lowell. He's the medical director of our cardiac rehab program and a practicing cardiologist in our community. Dr. Lowell, over the past year now, we've seen the pandemic, COVID, we've seen the surge. What are you seeing in terms of the cardiac conditions that are being presented to you sort of post-COVID?
So the most common thing we see is a result of inflammation, and that is a tightness in the chest or palpitations. Many people who've had COVID complain that their heart rate is pounding very fast with minimal degrees of exertion. That's probably the most common manifestation of the majority of patients. Remember, most people have COVID, recover quickly from it, and are never really made that sick by it. But amongst the people who are hospitalized with COVID, who have high viral loads or viral involvement, we see that the virus COVID initiates a tremendous inflammatory response, and that leads to clotting, as so many of us have heard. And it's thought that a lot of the rise in heart attacks that we've seen have to do with increasing thrombosis or clotting of the arteries in the heart, generally in people who had pre-existing heart problems. Additionally, we're seeing the late development of congestive heart failure in some of our patients. This is a result of either heart attacks they may have had or something called myocarditis. In general, it's suggested that maybe 10% of people who are hospitalized with COVID have cardiac failure related to this condition called myocarditis, which is an inflammation initiated by the virus, and our body's immune system seems to affect the heart.
So Dr. Lowell, how about the patients who only have, I'll say, mild symptoms? So maybe they've come to the emergency room, were treated and released. Do they have the possibility of developing also some cardiac conditions?
There's always that possibility, yes, and that's the majority of people that have been afflicted by this virus. Most of those people return home and return to normal life. It may take weeks, it may take months, and there are certain measures that we doctors recommend to return people to their previous functional state more quickly.
Now, what are you seeing also in terms of age groups, post-COVID?
Right. Well, COVID's been a diverse disease, and people of all ages have been affected. Young, old, people who are immunocompromised, and interestingly, certain socioeconomic groups seem to be more afflicted. So it affects the gamut of people across the board.
Okay. Now, how about, so the patients are coming home, is there any type of follow-up they should be seeking or any test screening that they should be looking for?
Yes, indeed. They should follow with the doctors that cared for them during their illness, and many patients develop symptoms after they've left the hospital. Many of those are cardiac related. And I tend to feel that, while we don't do pan screening for everybody, the development of cardiac symptoms and conditions related to the heart are so common that I do believe they should follow with a cardiologist and possibly have cardiac testing, because this is evolving into a cardiac disease as well.
People can get overwhelmed when they hear cardiac testing. Can you give us an idea of the types of tests that they would be running through?
Well, a simple EKG or just chatting with the doctor about their symptoms or relating what they're feeling. It's rare that someone's been ill with COVID that goes home and feels 100% right away. So everyone needs follow-up, and even during the hospitalization, there are things that remain yet undisclosed. Like, people complain of shortness of breath, but there are many causes for it, and there may be many bases for it. I mentioned to you earlier this morning that there was a patient that I have seen just today with COVID pneumonia who subsequently had a heart attack. But much of his symptoms, which he referred to or expected were related to his COVID, were indeed his evolving heart attack, and he didn't seek the help that he thought he should have had.
So you got to be careful, and you got
gotta
to
be careful.
attentive to your own physical well-being.
We like, obviously, chatting with the patient, examining them, an EKG, and sometimes an echocardiogram is helpful as well. The echocardiogram, or the sonogram of the heart, enables us to look at the heart's function. Many people complain of palpitations, and those palpitations are secondary to something else. So investigating it is warranted.
Okay. Let me shift gears a little bit. You know, I introduced you. You are the medical director of our cardiac rehab program. Can you talk a little bit about what that program can do for the post-COVID patients?
Sure. Well, every patient who visits us at cardiac rehab has their case individually evaluated and their conditions assessed, and then the team, which includes nurses, an exercise physiologist, and their doctor, dictate a prescription as to what their individualized exercise program should be. Cardiac rehab is not only an exercise program, but an educational program. Many people afflicted with heart disease, and we see more than just heart attacks at cardiac rehab. We see people with congestive heart failure and the like. There's an educational process. There's a support group that takes place there. The patients love coming, and they enjoy visiting with each other. And there's a sense of confidence that's built over the course of time. So we work with the patients and get them back physically fit. You know, COVID is a debilitating condition, and people who were fit before being afflicted by it rapidly decondition. So this is a fantastic way of getting people back to where they were before their illness.
Now, like I asked you about the types of tests when they come to the office, what types of exercise equipment are the potential patients going to be utilizing?
Well, we have, as I said, each person's exercise prescription is individualized, so some people have difficulty walking, but we have arm ergometers or arm machines, and we have treadmills and bicycles and things of the sort. Our goal and our effort is to return the patient to a functional state, better than they were before they took ill, but within the realm of their capability, recognizing that everybody's a little different.
Okay. So, you know, we've covered a fair amount of ground this morning. Are there any questions I should have asked, or any information that you think might be relevant that we missed?
Well, I think it's important that people recognize that they will ultimately get back to the lifestyle that they were enjoying before. They either took ill with COVID or a heart attack. Many years ago, people were afflicted by a heart attack, and their lives were adversely affected, and that they expected that would be the future. In some sense, having a heart attack is a wake-up call to begin living a healthier, smarter life, enjoying things, appreciating things better. And one of the things we do at cardiac rehab is focus on just that.
Okay. Thanks, Dr. Lowell.
My pleasure.
Again, thank you, listeners, for watching Let's Talk Health. Again, we've been with Dr. Barry Lowell, who's the medical director of our cardiac rehab program. If you require or look for different information, additional information, please go on our website, www.stclares.com, and also look for future segments of Let's Talk Health.